This is Pack 365. I'm myself Srija. Today, you're going to learn about the ICD-10 code ranges for diseases of esophagus, stomach, duodenum, appendix, hernia, colitis, and enteritis. Coming to diseases of esophagus, stomach, and duodenum. This code ranges from K20 to K31. This section of ICD-10 it covers diseases that affect the upper part of the digestive system, that is the esophagus, stomach, and duodenum, which is the first part of the small intestine. This is defined by WHO, the World Health Organization. These are used by the medical coders, doctors, and hospitals to classify and record the diseases involving the upper gastrointestinal tract. So in the code range of K20 to K31, these are the codes involved. What are they? Diseases of esophagus, stomach, and duodenum. Contains ICD-10 codes for esophagitis, gastroesophageal reflux disease, other diseases of esophagus, disorders of esophagus, duodenal ulcer, gastric ulcer, peptic ulcer, gastrointestinal ulcer. So all the types of ulcers related to the stomach, right? So the code range starts from K20. So K20 code denotes for esophagitis. So what do you mean by esophagitis? Esophago means esophagus. It's a medical term for esophagus, whereas itis means inflammation. So esophagitis determines the inflammation of the esophagus, often caused by acid reflux, infection, or irritation. So through acid reflux, infection, and irritation, the esophagus get inflamed. For example, eosinophilic esophagitis. So what do you mean by eosinophilic esophagitis? It's a chronic allergic inflammatory condition of the esophagus. Esophagus means the tube. It's a tube. Here you can see the picture. It's a tube that connects the mouth to the stomach, right? So this esophagus, it consists of lower esophageal sphincter as well as upper esophageal sphincter. So this eosinophilic esophagitis, it's a chronic allergic inflammatory condition of the esophagus, and it happens when the type of WBC means white blood cells, called as eosinophils, it builds up in the lining of the esophagus, and in that condition it is called as eosinophilic esophagitis. And this condition when a patient gets diagnosed with eosinophilic esophagitis, so K20.0 ICD-10 code is assigned. So what are the symptoms of this condition? The symptoms like painful swallowing, heartburn, and also chest discomfort are the symptoms of this esophagitis. So next, coming to K21 code. What is K21 code? It's a GERD. So what do you mean by GERD? It's a gastroesophageal reflux disease. When it occurs when the stomach acid flows back into the esophagus, causing irritation or damage. Here you can see a clear picture of GERD. So this is the stomach. So when the food bolus pathway from esophagus to stomach takes place, here there will be the increasing pressure of the food bolus movement. So during this increased pressure, there will be a formation of gastric reflux or acid reflux. So due to this gastric reflux, the stomach acid, the acid contains present in the stomach will bounce back. So will again flow back into the esophagus. You can see over here, due to the stomach acid flow back into the esophagus, it causes irritation and damage. This results in gastroesophageal reflux disease. And the common condition, it's the common condition seen in the outpatients. The main symptom of GERD is heartburn. And then next, coming to K22 code. K22, it denotes the other diseases of the esophagus. So what are the other diseases except esophagitis and GERD? So what are the other diseases of esophagus? How many diseases rather than esophagitis and GERD are present? So those are classified in the K22 code range of ICD. So for example, K22.0, it determines achalasia. So what do you mean by achalasia? It's a condition. So it's a condition where failure of lower esophageal sphincter happens to relax. So achalasia, when a person is diagnosed with this condition, so K22.0 ICD-10 code must be assigned. It includes structural or functional problems of the esophagus that are not classified elsewhere. For example, there are the other examples like K22.2, which indicates esophageal obstruction, whereas K22.7, which indicates Barrett's esophagus. These are all the diseases which are associated with the swallowing difficulty or the chronic reflex. So, diseases related to a swallowing difficulty are classified in the code range of K22. So next, coming to K23, these are the disorders of esophagus in diseases classified elsewhere. Here, used when the esophagus is affected secondarily. Until and unless K20, K21 and K22, these are the primarily affected esophagus diseases, whereas K23, it determines the esophagus is affected secondarily by the another disease. For example, infection. So whenever the another disease takes place, so due to that reason, it's a secondary condition, secondary esophagus condition is classified in K23. For example, K23.0, what it is? Tuberculous esophagitis. Always use this condition in addition to the main disease code because it is a secondary classified, right? So it is always used in addition to the main code. So next, coming to the gastric ulcer. So what do you mean by gastric ulcer? Gastric, so gastro is nothing but it's a medical term of stomach. So ulcer, what do you mean by ulcer? It's an open sore that forms on the lining of the stomach, duodenum or the other parts of the digestive tract when the protective layer is damaged. So this ulcer, they can be acute and both chronic as well. Whereas acute, it develops suddenly and lasts for short duration, but chronic, it develops slowly over time and it tends to reoccur if not properly treated. So chronic is a bit serious condition than the acute because it tends to reoccur if not properly treated or properly medicated, right? So it penetrates deeper layers of the stomach or duodenal wall. So for example, what is the example of the gastric ulcer? K25.0 code, it denotes acute gastric ulcer with hemorrhage. So hemorrhage is nothing but stoppage of the blood. Yeah. So hemorrhage is nothing but it's a bleeding. So what did you understand by acute and chronic gastric ulcer? Acute, it usually involves only the superficial, means only the upper layers of the stomach or the intestinal lining. Whereas this whereas chronic gastric ulcer, it involves the deeper layers of the stomach or the duodenal wall. And next, coming to the code K26. K26, it denotes duodenal ulcer. So ulcers forming in the duodenum are called as duodenal ulcer. Here you can see clearly in the picture how a healthy stomach looks over here and how a stomach with ulcer and also the duodenal ulcer. Here you can see clearly how the ulcer looks. It's an open sore that forms on the lining of the stomach, right? This is a stomach. So these are the open sore throats. This is a stomach ulcer, this is a duodenal ulcer, and this is the peptic ulcer. So coming to the codes, K26, for example, K26.0. What it is acute duodenal ulcer with hemorrhage. As I said, hemorrhage is a bleeding and acute duodenal ulcer. So an ulcer located in the duodenum is called as acute duodenal ulcer, and acute is the so acute means it develops suddenly and lasts for the short duration. So K26.0, it indicates acute duodenal ulcer with hemorrhage. So whenever a patient is diagnosed with this condition, so K26.0 code would be assigned. And this, what are the similar causes of these ulcers? Mainly acid, stress, or bacteria, right? So K27 code, it denotes peptic ulcer. Here you can see what is peptic ulcer. And site unspecified. So whenever a site is unspecified for peptic ulcer, so this K27 codes must be assigned. For example, K27.0 code, it denotes acute peptic ulcer with hemorrhage. So whenever the ulcer is confirmed, but it doesn't confirm what's the exact location, whether a stomach or duodenum is not stated. So give this code. Coming to K28, it denotes gastrojejunal ulcer. So what do you mean by gastrojejunal ulcer? Gastro means stomach and jejunal means jejunum, the second part of the small intestine, right? So it occurs at the junction between the stomach and jejunum, often as a post-surgical complication, means after gastric bypass or ulcer surgery. What are the examples? K28.0, acute gastrojejunal ulcer with hemorrhage. So whenever this condition is diagnosed, so give this K28.0. And K29, gastritis and duodenitis. So gastritis means inflammation of the stomach, duodenitis means inflammation of the duodenum. For example, acute hemorrhagic gastritis. So these causes include infection, alcohol, spicy foods, and also NSAIDs. And these all diseases which are listed over here, they cover the inflammation of stomach and duodenum. So next, K30, functional dyspepsia. This refers to the indigestion or upper abdominal discomfort without any identifiable structural cause. So what are the symptoms of the functional dyspepsia? Bloating, nausea, early fullness after meals. So you can feel a bloating like sensation or nausea like sensation after meals regularly. So coming to K31, this code range, it covers other diseases of the stomach and duodenum. For example, K31.5, what it is? Obstruction of duodenum. What do you mean by obstruction actually? Obstruction is nothing but there is a blockage in the pathway. So obstruction of duodenum means a blockage in the duodenum, which is the first part of the small intestine just after the stomach. So this blockage, it prevents food fluids and also the digestive juices from passing normally from the stomach into the rest of the intestines. And next, coming to the next slide, this section of ICD-10-CM, it covers diseases that affect the appendix. So what is appendix? It is a small finger-shaped pouch attached to the beginning of the large intestine, nothing but cecum. Though its function is not fully understood, it can become inflamed or infected, leading to appendicitis and all other conditions. So what is the code range for disease of appendix? K35 to K38. Here you can see the picture of appendicitis. This is a normal appendix and this is an inflamed appendix. You can see here the inflammation. The inflamed, it is irritated and inflamed, and it also a few bulged. So what are the codes after appendicitis? We have acute appendicitis, other and unspecified, and also other diseases of appendix. So acute appendicitis. This code category is used when the appendix is suddenly inflamed and it requires immediate medical attention, often surgery. Surgery means appendectomy, removal of appendix. So it can lead to the rupture or absence if untreated. For example, K35.2, acute appendicitis with generalized peritonitis. So what are the symptoms of acute appendicitis? Sudden right lower abdominal pain. So you can feel the right lower abdominal pain. You can also feel the sensation of fever, nausea, and vomiting. So the only treatment of this appendicitis is removal of the appendix organ. K36, other appendicitis. Other means used for non-acute or chronic forms of appendicitis that do not fit under the acute category. So K35 it is completely for acute appendicitis, whereas other than the acute or non-acute or chronic forms, the other forms are used for or categorized under this K36 code. So whenever a non-acute or chronic form is assigned or diagnosed, so give this K36 code. So what do you mean by non-acute forms? The appendix is inflamed but not in the sudden or acute stage, right? It is not inflamed but it is in the sudden acute stage. This could be recurrent subacute or also residual inflammation after prior episodes. So what are the symptoms of this non-acute forms? Mild or long lasting rather than the sudden and severe pains. So next, K37, unspecified appendicitis. So whenever the type of appendicitis is not clearly documented, like not stated as acute or not stated as chronic or not stated as other types of appendicitis, you can assign this code called K37. For example, when the medical record only states appendicitis without more detail, so give this K37 code. So always try to code a more specific type K35 or K36 if possible. So whenever K35, K36 is not possible, in that conditions only you have to give this K37 code. Whenever the document is not clearly given. So K38, other diseases of appendix. This category it includes appendiceal disorders other than the appendicitis. Usually appendicitis is the most common condition related to appendix, but there are other disorders of the appendix other than the appendicitis. So such disorders, so such diseases like structural or functional problems are coded over here. For example, hyperplasia of appendix. So K38.0. So whenever a patient is diagnosed with hyperplasia of appendix, so give this K38.0 code. What do you mean by hyperplasia of appendix? Hyperplasia, it's nothing but abnormal increase in number of the cells. So the abnormal increase in number of cells in the wall or lining of the appendix, so which makes the appendix wall thicken and enlarge. So that this condition determines the hyperplasia of the appendix. So these are all the codes of appendix and appendicitis. Now next, coming to the code range for hernia. Hernia. So in this section of ICD-10 code covers diseases that affect hernia. So what do you mean by hernia? Hernia occurs when an organ or tissue pushes through a weak spot in the muscle or the surrounding tissue wall that normally holds it in place. It's like an internal bulge, right? It's like an internal bulge where part of the intestine or fat, it pokes out through a weak muscle area. So now there are many types of hernias. So what code range you give for hernia? It's K40 to K46, which is a medical classification list by WHO, that is World Health Organization. So we do have inguinal hernia, femoral hernia, umbilical hernia, ventral hernia, diaphragmatic hernia, and also the other abdominal hernia and also the unspecified abdominal hernia. So next, first coming to K40. K40 code, it determines inguinal hernia. So what do you mean by inguinal hernia? In the next slide, I have the picture of types of hernia. So this, it includes direct, indirect and bilateral inguinal hernias. So what do you mean by inguinal hernia? The hernia occurring in the groin area, where the part of intestine or abdominal tissue protrudes through the abdominal wall or into the inguinal canal. So this types includes direct type, indirect type and also bilateral inguinal hernias. So whereas coming to K41, which denotes femoral hernia, this hernia that occurs just below the ground. Inguinal means it occurs in the groin area, whereas femoral, it occurs just below the groin area in the femoral canal, that is in the thigh area. And this type of hernia, it's more common in women than men. Yeah, here you can clearly see the picture of hernia. This is the femoral hernia. This is the inguinal. So inguinal you have both indirect and indirect hernia, whereas umbilical hernia, incisional and epigastric hernia. Here you can clearly see inguinal hernia. It is occurring in the ground area, whereas a femoral hernia, it is below the ground. So this is the ground. In the ground area exactly is a inguinal hernia. So below the ground area it's a femoral hernia. And then K42 code is assigned for umbilical hernia. So whenever a patient is diagnosed with umbilical hernia, so just give this ICD-10 code called K42. So what is umbilical hernia? This is around the navel. So this is the navel, right? So it is present around the navel where abdominal contents push through a weak spot in the abdominal wall. So this type of umbilical hernia, it often seen in infants but can occur in adults. So coming to K43. K43 means it's a ventral hernia. It's a hernia in the anterior abdominal wall that is not inguinal, femoral or umbilical. It often occurs at the site of previous surgical incisions, that is incisional hernia. So ventral hernia, it is also denoted as incisional hernia. So next coming to K44 code. So when do we assign K44 code? Whenever a diaphragmatic hernia is diagnosed. So what it is? The hernia which occurs in the diaphragm, allowing abdominal organs to move into the chest cavity. This includes congenital and also the acquired types, for example, hiatal hernia. And coming to K45, the other abdominal hernia. Rather than the above mentioned hernias, if any other abdominal hernia is diagnosed, so just give the code K45 specifying other abdominal hernia. These do not fit in the above categories such as epigastric or parastomal hernias. And K46 unspecified. So whenever the type or location of the abdominal hernia is not documented, so just give this K46 code. And it is used when the type or location of the abdominal hernia is not documented. Right? So what's the next session of codes? It's a non-infective enteritis and colitis. So this section of ICD-10-CM, it covers diseases that affect small intestine. Enteritis means, entero means small intestine, itis means inflammation, and col means colon, and itis means inflammation. So inflammation of the colon, nothing but inflammations of the small intestine and a part of the large intestine. So when these inflammations are not caused by infection like bacteria or viruses, they are called as non-infective enteritis and colitis. So whenever these infections are not caused by bacteria or viruses, so they are called as non-infective enteritis. The name itself gives the whole meaning. So these are the chronic diseases, meaning they last for a long time and may come and go. So what diseases are covered over here? Here you can see a picture, that is Crohn's disease and ulcerative colitis. What do you mean by Crohn's disease? You can clearly see here the picture. There are the patches, there are the inflamed patches in the Crohn's disease, whereas in ulcerative it is a continuation of a part. Here only patches over some parts of the intestine, whereas ulcerative colitis means a complete part of the intestine. Yeah, now let's look into these codes. K50, it determines Crohn's disease, is also called as regional enteritis. Crohn's disease, it's nothing but it's a chronic inflammatory bowel disease that can affect any part of the gastrointestinal tract from mouth to the anus. So most commonly the terminal ileum and the colon. These are characterized by the patchy inflammation, deep ulcers, and sometimes fistulas or strictures. Here you can see this is the patchy inflammation, this is the Crohn's disease, whereas in ulcerative you can see the continuous inflammation. And here in the Crohn's disease, here you can see the thickening of the colon wall. whereas in ulcerative there is no thickening of the colon wall. So ulcerative colitis, the code K51, it is nothing but it is a chronic inflammatory bowel disease which is limited to colon and rectum. So this inflammation only takes place at the parts of the rectum and colon. This is the inflammation which is continuous, so not patchy. Crohn's disease is patchy, whereas ulcerative is continuous, as I said. This affects the mucosal layer of the bowel. These symptoms it include blood, diarrhea, abdominal pain, and also the urgency of the bowel movement. So whenever ulcerative colitis is diagnosed, so just assign this code called K51. So coming to K52, other and unspecified non-infective gastroenteritis and colitis. So inflammation of the stomach and intestines are not caused by infection and are not classified under Crohn's or ulcerative colitis. So this includes conditions like allergic or drug-induced colitis, eosinophilic gastroenteritis, or also unspecified non-infective gastroenteritis. So this is all about the Crohn's disease and ulcerative colitis, right? And this is all about today's session. In the next session, we will be able to learn about CPT code ranges for diseases of digestive system. And thank you. Have a good day.